Good morning, everybody, and welcome to the last session of the Iowa Ideas Conference. I'm your moderator for this session. I'm Lyle Muller. The session, The Needs of Aging Iowans, is within the track Healthcare. And in this session, we will talk with our panelists and address audience questions as well. If you have questions, put them in the question box. All of our sessions have closed captioning access, and all of our sessions are being recorded. Before we start, the entire Iowa Ideas team would like to thank the conference sponsor, ITC Midwest. Their support makes this possible so that all of you can attend without having to pay a fee. So we're grateful for the support of ITC Midwest. Our panelists today are Shelley Sent, the CEO of Elderbridge Agency on Agency up in Spencer, Paige Yonts, the State Advocacy Manager at AARP Iowa, which has its main office in Des Moines, but covers the entire state, and Angela Van Pelt, the long-term care ombudsman for the state of Iowa. So welcome, ladies. Glad to have you here. I'd like to start with each of you elaborating briefly on what you do and how it connects to our topic today. Why don't we start with Paige?
Well, thanks for the introduction, Lyle. Happy to be here today. My name is Paige Johns, and as Lyle mentioned, I'm the State Advocacy Manager for AARP Iowa. AARP, as many of you know, is an organization that advocates on the behalf of Iowans and Americans across the country over the age of 50. So anything and everything that touches someone over the age of 50 is something that we engage in. So it's a perfect relation to today's topic on aging Iowans and what they need. So my background's in healthcare administration. I previously ran an 80-bed skilled and a 55-bed assisted living, ran a couple family medicine clinics, and did compliance for an ophthalmology practice. So healthcare administration is my nuts and bolts. Seniors are my passion, and public policy is the fun stuff I get to do.
Shelley.
Hi, I'm Shelley Sent. As Lyle said, I'm the CEO of Elderbridge Agency on Aging. There are 6 area agencies on aging in the state of Iowa, so I'm one of 6. My agency serves the 29 counties in northwest, north central, and down into central Iowa. Our job is to advocate also for senior, or we don't use senior anymore, for older Iowans' needs. And our focus is on home and community-based services to help folks age at home in their home and community for as long as they possibly can. I have worked in the Aging Network for 26 plus years now, so obviously it's my passion.
Angela?
Yeah, good morning, and thank you for the opportunity to address Iowans. I'm the State Long-Term Care Ombudsman. Our office is a federally required office, so every state has an Office of State Long-Term Care Ombudsman. In Iowa, we have the state divided out into regions. So we have 7 regional ombudsmen that actually go in and talk to individuals in facilities or individuals that have filed complaints with our office. We do pretty much, I guess I would call it self-directed care and advocacy. That means that we're going to deal with individuals at the level that they want assistance and help, and that we're going to work at their direction. So we're kind of more towards the end of that continuum of care. So that's kind of how we relate here. We also have a managed care ombudsman program that does deal with individuals that are receiving community-based services that are enrolled in managed care. So that's kind of another arm of what we do. So great to be here today.
Thank you. The Older Iowans 2023 report that the state produced shows that about 567,000 people in Iowa are age 65 or older. That's almost 18% of Iowa's population. But as we look ahead to 2020 or 2060, the projection is that it would be about 730,000 or 21%. So there's a growth of elderly in Iowa. We're an aging state. Meantime, AARP, your group Paige, came out with a long-term services and supports scorecard showing that here we are 3 years after COVID-19, and that at least began, that care provided in the United States for older Iowans is inadequate. And people with disabilities, same thing. Could you talk a little bit about what's going on in that report in terms of funding and the expenses, and what Iowa's role in this all is?
Yeah, absolutely. So for those of you who are unfamiliar, the long-term care services and supports scorecard that we put out, I believe we put it out every 2 to 3 years. This is my first year with AARP, so this is the first scorecard release that I've participated in. But this scorecard looks at kind of a cross-section of all of the different types of supports and services that aging individuals need to access. And it really gives it a report card score of how is our state doing in access to those things, the quality of those services, and really where are we lacking. So one of the things that I would like to highlight about that scorecard that I think will really spur some conversation for us as a whole in a panel. One of the things that we really highlight is the fact that we really lack funding as it relates to home and community-based services. We are really lopsided in the balance in our state in how we fund home and community-based services versus institutional-based services. And that's not only true for aging Iowans, but as you mentioned, Lyle, that lack of funding towards home and community-based services also impacts, women, children. It impacts individuals with mental health disorders, impacts individuals with disabilities. So it's not specific to aging Iowans that this lack of funding impacts. So that's one of the top things that scorecard highlights. Another thing too is that while we lack the funding to create those home and community-based services, the services that are available are too expensive for Iowans to afford. So it's wonderful if you can find a home care provider, but in Iowa, you are likely going to spend about 95% of your take-home pay to pay for that home provider. We rank 46th in the nation in the cost of home-based care. So not only do we lack that care, but the care we do have is way too expensive for Iowans to afford. A third point that scorecard really highlights is a lack of adult day services. So I'm sure we'll talk about the continuum of care later on today. But a component of that are support services for individuals who are still capable of remaining in their home with caregiver support. But as a supplement to caregiver support, adult day services are often really valuable for those home caregivers. And adult day services are exactly what it sounds like. It is a center or a place where somebody can bring a loved one who they're caring for, drop them off and know that they're in good hands while they go run errands, while they go do the things that they need to do, go to their own doctor's appointments, that kind of thing. But Iowa really lacks in that adult day service, regardless of where you're at. And then the last thing that the scorecard really highlights, and is something new to the scorecard this year, is specific to greenhousing and home focused or home designed care. So rather than a traditional nursing home setting that's an institutional based, where you think of your long hallways with several rooms down a corridor, greenhouses or residential models of care set up small houses as a way to provide skilled nursing. So rather than having perhaps 80 individuals on a wing, there's 12 people in a residential style house that looks and feels like home and is centered around a central kitchen. Everybody has their own bedroom, their own bathroom, their own shower. It's something that we know that A, Iowans want, and B, is something that can really make a difference on the quality of care that we provide and the funding that it requires to get that up and running. So those are kind of the top 4 things that scorecard really highlights. And I think these are certainly things that I'm sure Angela and Shelley can, attest to from their work as well.
And I'd like to hang on to that idea of greenhouse homes, and we can talk about that a little bit later. Angela, do these kind of concerns sound familiar to you? Is this the type of thing you hear?
Yeah, definitely. I think that there's a lot going on right now with care in facilities in particular. As you know, I was faced a lot of facility closures in the last couple of years, and we don't anticipate that that will slow down. So we completely agree that kind of that paradigm shift needs to occur with the balance of home and community-based services versus just the option for facility-based services. We too are very supportive of the smaller footprint for facilities. I think one of the things too that goes along with that, Paige, is the enjoyment that staff have in providing care in a setting like that versus maybe more of an institutional setting. And right now, one of the biggest issues we're facing is workforce shortage. So I think all around, really looking at those models is going to be important for Iowa.
Generally, people with these types of concerns or in this kind of situation come to Elder Bridge Agency on Agency. And so what do you hear from them, and what are some potential solutions that you try to provide for them?
Right. So, when folks come to us, they want help figuring out how to stay at home. And so the starting point is we help them find those home and community-based services that are available. Along with Paige and Angela Echo, that's becoming more and more difficult because of the workforce shortages and because of funding issues. There doesn't seem to be as many young people going into working in the healthcare field. And so we see workforce shortages out there. One thing we have done is really ramped up our volunteer program to try to provide other alternatives to folks for things like telephone reassurance or transportation. Transportation is a huge issue in rural Iowa. We have regional transit authorities, but it's pretty cost prohibitive for them to go out and pick somebody up in a rural area and bring them to like a doctor's appointment or something. So we are really focused on increasing our volunteer base because funding for home and community-based services is not increasing. Aging Iowans is increasing, and it really, the pandemic really increased the demand for folks needing that home and community-based service. In FY 21, we served an additional 27%. Our client load went up 27%. Last year, another 8%. So demand is increasing, funding is not. So we have to get real creative in trying to figure out ways to, utilize the resources we have, but also recruit and train volunteers who can help us and have a passion for doing that.
And one of our viewers here in the session has a question related to what we're talking about here. What's being done to recruit more workers and support entrepreneurs to develop more home and community-based older adult care? Can any of you answer that question?
Well, I think we all wish we had
we're all like taking a deep breath and like, well, we don't know.
I can speak from a personal perspective. As a 20-something right out of college, I knew that I wanted to go into healthcare administration. I knew that I had a passion for seniors, and I knew that that was something I wanted to pursue. I would say that had I not been exposed to that at an early age, I was exposed to that in high school. I was very fortunate to have had exposure to a healthcare setting. I was a medical surgical research assistant in high school and realized that I don't want to be a doctor, but I love the administration component of healthcare. But I am a fortunate individual to have been able to have that experience. And so something that AARP really strives to work on as it relates to workforce is intergenerational programming and helping expose younger students to aging services careers. I recently had a meeting with a local school district about how can AARP engage in talking to students about what it means to age. What does it mean to care for somebody who's aging? What kind of careers are available in that? And so I think that's one component of the workforce equation that we need to consider, and that we shouldn't count out as to how much of an impact that can have. Is that a long range play? Absolutely. That is not an immediate solution. But in our quest to figure out this workforce solution, we have to look at short term and long term. So I am really passionate about that long term solution and getting kids involved now in aging services. But on the short term, the issue we really have to address, and really the elephant in the room, is the low wage scales that we are seeing for direct care workers. I think that is 100% one of the most significant contributing factors to our lack in workforce today. You can work a quote unquote simple retail job for 20 bucks an hour, and to be a CNA in the state, you're not coming close to that as an average. And we know that a living wage today is much higher than it was 20 years ago, even 10 years ago. And I'm sure, Angela and Shelley, I'd love to hear your perspectives too. I think it goes beyond wages, but I think that that's certainly a key component to understand.
What's going on there with the wages? Why aren't the laws of supply and demand taking place where the price would go up for the labor?
I would say it's a lack of funding. Availability is a lot of it. I will tell you, I agree with Paige. What we could pay, say, a social worker, a case manager for a wage, even 5 years ago, and retain them. We can't do that anymore. I had to, because of the pandemic, I had to go and reevaluate my entire wage scale and increase those wages. Because you're right, if somebody can go down the street and work at the steel mill and make $20 an hour, how do we recruit professionals in the medical field, in the social service field, when we're not paying them a fair wage? So that is really big. And I agree with Paige. We're losing nurses. I just heard something the other day on the news that even there are even professor shortages in educating nursing programs, working in nursing training programs. And because of that, even people who are applying to go into the field are being denied because they don't have capacity to educate that number of people. So it is a big umbrella, broad, nationwide dilemma, I believe. What do you think, Angela?
So just a couple points that are kind of in alignment with what you're saying, but I want to kind of tag on a few more. I think that for facilities in particular, I think there's a lot of cultural issues. And I think that because of the low wages, I think that there's kind of a devaluation of the worker as well as then the individuals that are being served. And I think that culture is not helping to bring people into those kinds of roles. The other thing that I want to say about just money into the system in general, there's a lot of visibility right now on all of the money that goes into the system. And this does relate to then what's left over for HCBS service providers and things like that. Right now within the facility world, there's a lot of discussion about all of the money that comes into the system, but how much is going to related third parties and for-profit organizations, and how much of that money is being taken out and spent to a firm, a corporation in profit, versus leaving that money available to increase direct care wages in the facility. And then overall, just the suck that has on the system in general. So I want to just throw that out there because there's a lot of conversation right now about that issue also, and the drain it is on the system.
Yeah.
Thank you. There was the phrase continuum of care was dropped in our opening discussions. And what do we mean by continuum of care, and why is that a concern? Shelley, you want to start that one?
Yeah, when we talk about continuum of care, it basically starts with the person in their home and community, which is where they start in our system. And so the first thing we have to look at is if they wish to remain in their home and community, what can we provide them for those supportive wraparound services in their home to support them and their caregiver, so that they can be safe and successful in their home. Um, we want to do that for as long as we possibly can. So that is why we talk about there needs to be funding in those home and community-based service pools. For the area agencies on aging, our primary funding source is the Older Americans Act, which is federal funding. But it's never enough funding to meet all of the needs. Then we have, the steps like the adult daycare. You're right, Paige. I think in my region, in my 29 counties, I have one adult daycare that's still functioning. And that has to do with multiple things, but a lot of it has to do with cost and reimbursement for that. And then we look at, okay, what's the next step? It might be assisted living, where the person can still, kind of manage their own care, but they need that 24-hour access to some supports. Unfortunately, there are a lot of older Iowans who can't afford to go into assisted living. It is very costly, and the only way they can go into an assisted living and not have resources to pay for that is for them to get on like an elderly waiver, which is a Medicaid funded. And not a lot of the assisted livings in Iowa will accept Medicaid funding either.
Why is
And
that?
then,
Why is that?
well, so there's a certain amount that will be funded by Medicaid, and it's only the service portion in assisted living. The individual still has to pay their own room and board. And so, they've got to have funding that covers that room and board cost. And the Medicaid reimbursement for services is needs based. It's not a flat, you get this much funding. So it's finding that balance of, does the person have enough to afford that room and board? And are they eligible for waiver services? And are those waiver services going to be enough to support that person in that living environment?
Thank you for that. Yeah, and then
Yeah.
to continue, you were talking about the assisted living and the next steps.
Yeah, the next step, obviously is nursing facility. And I'm going to defer to Angela to talk about that piece, because that's her expertise. So when a person needs that nursing facility, we will help transition them there. But then the area agencies on aging back out. We aren't involved unless the person rehabilitates in the nursing facility and is able to return home. Then we get involved and we help with that transition back home. But Angela is the expert on nursing facility.
I don't know about that, but I try, Shelley. So I think with the nursing facilities, obviously that's generally the last step in that continuum of care. One thing I want to mention about a lot of our facilities, though, do have individuals in them that maybe could be very successful still at home or in the community. Maybe that's just the only option for them in their community. So again, that kind of feeds into the whole thing of a lack of services in general to kind of keep individuals back where they're at. But, we also are going to be looking a little bit more into helping people that do want to get back out in the community, because we run into that a lot, especially after COVID. What happened to individuals during that phase was significant, was traumatic. The social isolation was very damaging. So we see a lot of people that really are trying to go back out or go back home. But again, that structure isn't really ready in all ways to deal with that level of need, unfortunately.
Paige, you had mentioned greenhouse homes, and I said we talk about that a little bit later, and now it's that time. And when we say greenhouse homes, that is an actual trademark for something. Explain a little more in depth about what a greenhouse home is and why it fits in with healthcare for older Iowans.
Yeah, no, that's a great point. So like you said, greenhouse is a trademarked style of or brand per se of long-term care. If you think of like the brand of Kleenex, we consider all tissues to be Kleenex for the most part, but greenhousing is a similar kind of trademark or nomenclature. A greenhouse is really a way to describe small model housing for a nursing facility level of care. Greenhouses are still skilled nursing facilities. Some of them are memory care units, and some of them are assisted livings as well. But the difference is what that setting looks like. So time after time, AARP survey indicates that Iowans and Americans across the country want to age in place. As Shelley said, they often come to the AAAs looking for a way to stay in their home. And unfortunately, sometimes that's just not feasible. And so something AARP recognizes is that there will always, always, always be a place for institutional-based care. We have to have that in our system. We cannot function without it. However, we lean far too heavily on it in Iowa. And so what we would really love to see are more small model housing options. And I want to differentiate this because I think a lot of people are familiar with small model housing when it comes to individuals with disabilities, perhaps. But this is a little bit different setup. A small model house in a skilled nursing context functions very similarly to a traditional nursing home. And it still requires nurses on site. It still requires CNAs. But one of the major differences is the workforce model that they support through their nursing assistants or their CNAs. They lean a lot on a universal worker model where you have a nurse, whether it's an RN or an LPN, but then you have staff that do a lot of other things all at once. So not only are they CNAs, but they might also help cook the meals. They might also help do the laundry or some of the housekeeping. And from what we know about COVID and even pre-COVID, we know that universal workforce models do have benefits to them. Are there challenges? Absolutely. And any model of institutional-based care will have a challenge to it, and any model of home-based care will have a challenge to it. There is no perfect, idyllic version of long-term care. It just doesn't exist. However, greenhouses strive to create a home-like environment that give residents the ability to age with dignity. A greenhouse model of care takes away things like a medicine cart rolling up and down the hallway. Typically, it's in a locked medicine cabinet like you or I might have in our bathrooms, but the nurses hold the key. It takes away a communal shower room. I can't tell you how many times I had residents of my own who really just didn't want to take a shower because they didn't want to go to a community shower room. Even though they were the only one in there, it didn't feel like their shower at home. And so a greenhouse model of care looks to give them their own private bathroom, their own private shower, so they can have their favorite soap in there, their favorite loofah. They can have their things in their shower. And that's really important when it comes to that sense of self. And what we know people need in that setting. Greenhouses typically center around a family style kitchen, just like a kitchen that we have at our house, usually on a little bit larger scale and with more accessible features. They want residents who are physically capable and mentally capable to assist in the cooking to do so in a safe manner. we know that food is a connector, and we know that that's something that brings people together and builds community. And so greenhouses really emphasize that. They want people to sit at a dining room table together. They want that to be a joyful experience. And so a small house model of long-term care really emphasizes resident choice and preference. It's something that really elevates residents' needs and desires above any sort of institutional agenda.
When we talk about housing and home care, health, it kind of raises a question: is there enough housing for Iowa's elderly, especially its growing population? And from that, we're going to move into the type of people who are providing that care. Angela or Shelley, one of you two?
So are you asking specifically about housing or like
housing? Yes.
That, okay.
First housing.
So I'm going to defer to you, community.
Yeah, I'm going to have 3 steps on that. Is there enough housing?
Yeah.
Is there enough housing or home-based care? And then who are those people providing the care? Those are the 3 steps we're going to go through here.
Okay, so you probably want to start with me. I will tell you that we are seeing a rise in homelessness in the older adult population. It doesn't necessarily mean there isn't housing, but it means that folks who are homeless maybe cannot afford housing in an actual apartment. And so, we're really looking at the area agency level of what do we do to help these folks who really have hit rock bottom, and maybe their Social Security income does not suffice enough for them to meet their basic needs. And we really have to be focusing on how do we locate those folks? How do we bring in wraparound services? How do we help them get affordable housing? And then that also leads into the lack of health care issue is, if someone's living on the street, they most likely are not accessing good health care. As a matter of fact, the other day, I saw someone sitting on a bench right on Main Street, Little Spencer, Iowa, who very obviously was homeless and had very swollen legs. And I thought, that person's not getting health care, let alone um, adequate housing basic needs. So I think we're going to see more and more homelessness with the current inflation, and we have to be ready to respond and try to help folks remedy that issue. Another thing that plays into it is mental illness. So we're seeing more and more people with mental health issues not having housing and not able to function or get care or treatment for those mental health issues. And we need to activate communities. You can't do it with one entity to address and do anything about the homeless population. It takes a team, and it takes a committed community, which we at the area agencies on aging are willing and want to be a part of that resolution.
Well, and are there enough caregivers, professional caregivers, to handle in-home care for Iowa's elderly?
Yeah, and I think I spoke to that a little earlier, but I do want to say in-home care givers, there is a workforce shortage. And so, nurses and folks who would go in and help with bathing, or, we have to look at there's healthcare and there's social determinants of health, and you can't succeed with one without the other. And so folks who need health care in their home most likely need also some other services such as home delivered meals, a personal emergency response system so that they can access emergency help. They might need transportation. Um, so there's a multitude of those services um, that that are needed by that individual besides that nurse or that home care aide coming in. One of the things that we're doing in Iowa right now that's helping that is it's called the Iowa Return to Community Program. And what we're doing is when a person's been hospitalized or in the nursing home and they're going to want to return to their home, um, healthcare only services does not usually prove successful for that return home. So we provide that social service end of things to help folks succeed in that transition, because we don't want them to have a relapse of their health issue or have to return to the hospital. Um, and we're finding that that's really a successful way to help people be more successful in returning to their community and succeeding there. And of course, it's always the issue is always funding. We would like to do that statewide, and I do see that as the upcoming trend, but we have to figure out sustainable funding. That's not something we can expand without additional funding, but it is a model that is proving to be very effective.
Unpaid caregivers do exist, and
Oh,
these are the family members who deal with an older patient 24/7, and often alone, and are can feel trapped. And what type of support can we as Iowans offer to someone who's in that position? Angela, you want to take a crack at that?
Well, I think that just being supportive as a community, as individuals within, within close range of those people that know the situation. I don't know that we actually realize how broad that issue is. So how many people are actually doing the caregiving, going to work, managing their own families, all of those things. So I think a lot of that support has to come from the community. And then just resources that are available. How do you navigate burnout? How do you navigate helping your loved one get the services that they need? And I know Shelley as a AAA, those are the things, some of the things that you guys focus on. And I would say if we didn't have family caregivers, we wouldn't be able to function, to be honest. It's a huge part of just caregiving in general. So I think just building up the supports for them that they know how to access, that they know how to get help or some respite if they're needing a break. All of those things are supports that we can give to family caregivers for sure.
right.
Well, and I would just,
Yeah, go
I would
ahead.
just add
Sorry.
I would add one comment to that. AARP does a lot of work with unpaid family caregivers, and we recently released a study called Valuing the Invaluable. And this is a caregiver study that we do nationwide. And I just wanted to provide some additional context to Angela's kind of comment on, I don't think we understand how broad this is. AARP's put a lot of time and effort into actually quantifying that. And across Iowa, we have over 330,000 unpaid caregivers across the state. And the economic benefit that they provide on an unpaid basis is over $5.2 billion a year. So if these caregivers were being paid, it would be $5.2 billion worth of work. And that's over 310 million care hours per year. That is an astronomical amount to me. And so this is a population that we are not leaning into at all in the state of Iowa and across the country, frankly. This is not top priority for people, but it should be. And on average, caregivers pay about $7,200 a year out of their own pocket to help care for their loved one. that's not an insignificant amount of money. I mean, $7,200 can go a long way, but it can also not go very far either, especially in today's market. So I just wanted to give a little bit of a numerical background to this too, because I think it's important that we really understand the gravity of the situation. And that as a state, we are failing to support them. We are not supporting our caregivers in a way that we could, and frankly, in a way that we should.
And
Um,
Shelley, go ahead, because
Yeah,
it seems that you would be training those
Yeah.
folks.
I'd like to jump into that. And area agencies on aging do, through our Older Americans Act funding, there is family caregiver support funding. We are very focused on that family caregiver because Paige is right. There are more unpaid family caregivers caring for people in their home than any paid caregivers. And so we have to be sure that we're supporting that family caregiver. Um, quite often the family caregiver neglects their own healthcare needs because they're so focused on caring for their loved one. And so we have staff, family caregiver specialists, who provide that counseling and support, those support groups for the family caregivers. We even one thing the pandemic did that actually was a good thing. It showed that we can do support groups virtually, and that works better for a lot of caregivers because they can't find somebody to stay with their loved one and they can't leave them. So we're focused on that. One thing we're also focused on is these caregivers. They don't have time to cook meals, and so we, through our funding, are able to provide home delivered meals for those family caregivers also. The other big thing I want to touch on is, um, you know, as Iowans are aging, dementia is becoming much more prevalent also. And that is a big focus of the area agencies on aging right now. Is we do have dementia friendly Iowa, um, and we provide training. And Angela's right. The community has to be a part of this. So we promote training. Anybody who wants to take the training on how to recognize and what are those basic things that you can do as a good community member to support that person with dementia in remaining home. But those with advanced dementia and caregivers, that's really difficult on those caregivers also. So we actually are asking in this next legislative session for some funding to have a dementia care specialist at each of the area agencies on aging, so that we can focus in more on those individuals and their caregivers. So I just want to be sure we identified that too, because that is a big trend we're seeing.
Well, and some of the roles that dementia would play in providing health care for older Iowans might seem obvious, but to give them a little bit of life and understanding and context, could the three of you describe some of the problems that causes? Paige, we'll start with you.
Yeah. And Lyle, you're just referencing some of the problems that this lack of support causes for family caregivers, correct? Is that what you're?
What we're talking? I'm talking more about what dementia, the roadblocks that dementia causes
Okay.
when you're trying to provide health care.
Yeah. The list is long for sure. And there's a lot of great partners across the state that engage in this. Obviously, the Alzheimer's Association does a lot of work on this. I think one of the biggest roadblocks that I found in my time as an administrator, dementia is very different for everybody. There is not a one size fits all approach to how you care for someone with dementia. And I think that that's really hard for families to come to terms with, because no one necessarily has a straightforward answer for them. Here's what you need to do in this phase, this phase, this phase. There's guidelines and there's some best practices, but it's so unique to each individual. And I think one of the biggest barriers to people seeking care who have dementia, or somebody who has a family member who has dementia, is that they're not able to come to terms with it. They're not able to really acknowledge that it's a support that they need. And so a lot of my time as administrator was spent counseling people to say, hey, like, it's okay to reach out for this help. It's okay to need this assistance. It's okay that mom can no longer stay at home. That's okay. Like, that is something I think the stigma surrounding it sometimes is really prevalent, that we need to continue to normalize the conversation about dementia and what that looks like and how we can support those individuals. But the other real challenge that I see a lot of times too is polypharmacy is something that's really prevalent in seniors. Seniors are on a lot of different medications all the time. And I'm sure Angela can speak to this from an ombudsman perspective, but a lot of times the effects of dementia can either be exacerbated or really ramped up when you have too many medications in this system. And this can be a really big barrier for families who just don't understand why. It doesn't seem like mom should be progressing this fast. What's going on? And that conversation about, is this medication really worth it at this point? What benefit is it providing? Can we, find something different that might have less side effects? This was something that was really prevalent in my time as an administrator. Angela, anything to add on that kind of front too?
Yeah, I think that monitoring of medications as family members or loved ones, and I'll say from a facility perspective, if you're a family member, you've got to get in there and you've got to be watching what's going on, because especially with dementia, it can be so cyclic. Like, you may have one day when your loved one is just like right there with it, and the very next day they're having delusions, they're seeing people, they're whatever, and then the natural inclination is to give them an additional med or to try to mitigate that issue. So I think as family members, being educated on options, what those medications do. I've had a lot of personal experience with my loved ones that had dementia, and very different experiences, right? Even though they were both advanced, one was behaving as a 3 or 4-year-old mentally, and the other one was still eating dinner, still having conversation, and then the next day it changes. So I think watching those medications, because some of them can have a very negative effect. Some of them are used as chemical restraints. So I think, again, my message is get out there, pay attention, and provide support in that way to your loved one by just knowing what's going on.
We have a question from someone who's watching this session here who has devoted a lifetime of work and research with advocacy for older Iowans. And the question is, so much of this discussion of home and community-based services versus care in a nursing home comes down to politics and the willingness of our elected leaders at the State House to expand funding to community care and reduce funding to institutional care. Can that change? And what would it take to produce it?
Angela, you want?
Yeah, I can jump in there.
And then I would like to add too.
Yeah. I think that we right now in this moment, in particular in the facility side of things, we have seen unprecedented times. We have seen behaviors and the way that our individuals are treated in facilities that are just kind of mind-blowing. And I think that we are in a good time and a good space to really have these discussions, right, in a very blunt kind of manner, where we're actually talking about the elephants in the room, right? And we're actually having discussion. There's public awareness, there's continued discussion, and that filters to the legislative arena, obviously. I think that we have state agencies, and I'll reference Health and Human Services, that realize that kind of disproportionate level of care and are working within their parameters to bring awareness to that and try to provide alternatives. I think a lot of people know that this is a time when we need action instead of just entertaining, another year of letting things kind of go as is, or just pumping more money in general into reimbursement rates for Medicaid, which need to be there. But again, I think there's bigger issues that also need to be discussions at the table. I do think this is the time if we're going to see change. I think we're living in that era when things are bad enough and critical enough that if there's not action, we'll continue to see things just declining rapidly. So it is political for sure. There's a lot of factors to be said about that. But I think people just need that open mindset in that conversation and things brought to their attention. And I'm hopeful.
And John, hello. I know John, and John is a strong advocate, and we appreciate that. I will say, I've been in this field for a lot of years, and I am feeling very optimistic, more optimistic than I've felt in a while. The state of Iowa is really going through a reorganization at the top level, and aging services was a standalone small department who has now been moved under Health and Human Services. I think we have opportunities to really advocate and be heard that there needs to be more focus on those home and community-based services. And I am pretty vocal about that. I do a lot of advocacy, both at the federal and state level, for that. So, John, hang on. I think we have some opportunities. I think we have folks at HHS who know that this is a need. Medicaid's looking at a whole revision of the waiver funded, waivers, Medicaid waivers. So I think we're facing a real opportunity to be heard. So keep talking, John.
Shelley, earlier. Oh, go ahead. I'm sorry to interrupt.
No, I was just going to say the one thing I would add, obviously, my role is advocacy, both federal and state. And I think I would agree with both Shelley and Angela. I do feel optimistic. And I think one of the important things to remember too is, in our current political state, yes, it is a political conversation. But in our current political state, we have to find ways where we can find commonalities between what advocates want, what industry wants, what consumers want. We cannot operate and move forward in a divided sense, and we cannot operate and move forward in a sense where it is pitting one against the other. That is something that AARP is very firm on. We know that any solution has to be something that everyone comes to the table and can be in agreement with. And that means that there's going to have to be compromise on both sides, whether that's politically, Democrat, Republican, compromise is there, but also industry, advocates, and consumers. There are going to have to be some level set expectations that we put forward that are going to have to, change in conversation. And where do we want to go, and where can we go, and what's feasible? I think it's great to dream big as to what we want to see happen. But I'm a very pragmatic and realistic individual. And I know that our wildest dreams may need to come down to reality with what's really feasible in today's market and in today's economy and in today's political climate. And so I am hopeful, and I do think that we have leadership within DHHS that really wants to see that at the state level. I encourage any advocate to approach these conversations with a sense of optimism and positivity, as opposed to blame and frustration, because I think that's where we've been before. And I think we've proven that doesn't work. So I think if we can come to the table with a renewed sense as to how we're going to approach this, we're going to go a lot further.
Kelly, earlier you spoke about some of the healthcare issues for older Iowans who aren't getting healthcare or can't afford it. And it would seem nutrition would be a problem there as well. Food security, and eating properly, eating with good health. What role does that play, and what is being done about it?
Yeah. So through the Older Americans Act, we do also receive funding at the area agency level for both congregate meals and home delivered meals. There are also Meals on Wheels providers that are a separate entity out there. Um, and s what we're seeing right now is the demand for food and the food insecurity for older Iowans is increasing. I think I just read this morning food insecurity among older Iowans is at about 8%. So that doesn't seem like a lot, but when you look at 8% of 300 and some thousand, that is a lot of individuals. And so we have needs for food for home and community-based individuals that unfortunately we have had to start a waiting list for those meals because of lack of funding. I also have focused my grant writer completely on writing grants for food because there's so much food insecurity. And we know nutrition leads to health issues that that can be avoided if there's proper nutrition. So we are focusing on that very, very heavily right now, and hoping that there might be some additional funding go to that nutrition program from the Older Americans Act. But we know we're facing an uphill battle to get any increase in funding right now because of the debt ceiling. But I've been meeting with staffers from our federal legislators and really informing them that food security for older adults in Iowa is a growing issue.
We are about 2 minutes away from wrapping up, maybe 2.5 minutes. Who advocates for older Iowans?
We all do.
There
Yeah.
you go. Yeah. And we already called out John Hale. And thanks for joining us, John.
We did call out John, but
yeah.
I love Iowa because we are I've lived outside of Iowa, and here in Iowa, we care about our neighbors. We care what's happening in our communities, and so I really believe that we have lots of strong advocates. What we need to do is all get on the same page, though, because when you have different people advocating for different things, that doesn't go very far in the legislature because they don't know which one to really pay attention to. So one of the things we've been focusing on through our state association is, working with AARP, working with the Older Iowans legislature, and sharing our priorities and making sure that we're all on the same page in our advocacy efforts.
All right. In our last minute here, I'd like to just go around the horn. Key takeaways that you hope people attending this session understand about healthcare for older Iowans. Paige?
Oh, goodness. So many things. But I think one of the primary takeaways I would have, and something that I come back to a lot in conversation, is that money is not the only answer to this problem. And I think a lot of times money is something we immediately go to as, if we just have, X number of more dollars, then it'll all go away. And that's just not true. So I would really encourage people to continue to think about outside of the box solutions. And if you have them, bring them to the table and bring them to somebody. Because I think one thing that any advocate would say is that if you've got an idea and you're not willing to share it, then you're not helping the cause whatsoever. And so bring your ideas to the table, show up for the people that you really want to engage with, and let's bring some practical solutions. I think we can all gather around and say, we need to fix this, we need to fix that. But we have to bring some practical solutions to the table to really workshop and say, is this even feasible? So that would be my key takeaway is, number one, money is not always the solution. And I would encourage people to think outside the box.
Angela, anything new to add to that?
I would just encourage people on an individual level to pay attention to what's going on, to be involved in your loved one's life, to get to know what they're experiencing on a daily level, because this is the deal. We're all aging. And the system that we're creating now is the one we're going to be in. You know, I look at myself and I think we're all going to be in the situation where we have to make choices about our care and with our loved ones. So really just kind of be involved, stay involved as individuals.
And Shelley.
I totally agree with both of you on that. The other key takeaway, I think, is we need to realize that there needs to be a better focus on home and community-based services, and try to get that shift away from so much focus on institutional care. Institutional care has its place, but I see folks going into institutional care prematurely when they could have been supported in their home and community if they had the resources to do so. So just want to encourage folks to continue to advocate for the home and community-based side of older Iowans' needs.